Mhm. Hi everyone, my name is Gloria. Hello. Hi everyone, my name is Gloria. Many thanks for joining us today. We are going to be having an interactive session with St. George University of London, the UK University Specialist Health, the UK Specialist Health University. Okay, we'll be learning more about the university. We'll be learning more about the university. We'll be having some questions and answers. And joining us today is Malcolm, the university representative. Hello, Malcolm.
Hi, Gloria. How are you?
I'm very fine. Thank you for joining us.
Thanks for having
us. I hope you have a great time with everyone of us today. So I'm handing over to you. Please introduce yourself and
Sure. Do you want me to get started? Yes, I can do that. So I'm just going to just share my screen. Let's see. Here we go. Absolutely seamless, I'm sure. So can everybody see and hear okay? Can you see the screen okay? All good? Wonderful. So good morning, everybody. Thanks for joining us today. I'm really excited to speak to you all in Nigeria today. I visited Nigeria in 2018. I've not been back since. I had a wonderful trip in Lagos and Abuja, a trip I've never forgotten and hope to come back again in the future sometime. So once again, thanks for joining us. You'll be hearing from me today. My name is Malcolm Davidson and I'm International Projects Manager for St George's University of London. We have Jane Cronin-Davis, who has many job titles, but I've just chosen two here, or just one, I think, Associate Professor and Course Director of Occupational Therapy at St George's, and Halamat Abdulganiu, who is a Year 1 MSc Physiotherapy pre-reg student from Nigeria at St George's of London. So who are we? I think it's quite easy to sort of say who we are. We're quite a unique university. We are the UK's specialist health university. So the only university that fully focuses on healthcare and health sciences. We're also a very old university. We're part of the University of London. You may have heard of this group of universities. So that's a group of large universities. That includes some top unis such as UCL, Queen Mary University of London, King's College, as well as Goldsmiths, Birkbeck, Royal Holloway, and other specialist colleges like St George's University of London and the Royal Veterinary College. We're also very unique in that as a health university, we're the only university that fully shares its site with a major hospital. So really, really unusual and unique place to study in that regard. So St George's itself is located on the site of St George's Hospital. St George's Hospital is one of London's 4 major hospitals and serves southwest London and then neighbouring counties such as Surrey. So from day one, it's a really unusual study experience, I think, and quite a unique study experience in that you are fully surrounded by the hospital life. Students often get a bit confused when I describe it. They imagine that they're literally sitting in hospital wards on their laptops. It's not like that, but the two worlds do kind of segue into each other. So it's a separate building with all the university facilities you'd expect. But as soon as you go into the corridor, if you head straight ahead or off to the right, you're already in the hospital corridors around the hospital life. When you go to the cafeteria, you may be queuing for a coffee next to nurses and doctors in their scrubs. I think as a healthcare student from day one, you get exposure to that clinical environment. And I just think it really gives you that extra edge when it comes to a healthcare career and healthcare study experience. We've also got some impressive stats. So I find working at St George's, they're a very modest university. They don't always shout about their achievements, but really impressive stat this year. We came as the #1 university for graduate prospects, according to the Complete University Guide 2023. So I do think students really get excellent career support in their programs. Also, naturally being a long-established healthcare university, research is a big part of what we do. And we are recognized as a top 10 university for research impact. That was according to the most recent REF, which was done in 2021, where the results were announced in 2021, and also ranked within the top 250 universities worldwide. When it comes to research, we have 4 major research institutes. There's a lot of kind of crossover, but these are kind of our 4 main research areas. That would be the Institute for Medical and Biomedical Education, Infection and Immunity, Molecular and Clinical Sciences, and Population Health. So when it comes to infection and immunity, I believe, Jane may correct me, but I do believe a lot of research into the recent COVID vaccine was done at St George's, which we're really proud of. And anyone who's interested, this actually was a recent documentary on the BBC called Unvaccinated about pros and cons of vaccination, and that was St George's was featured in that. So that was a really fascinating program to check out if you want to see a bit more about that. Not specifically about St George's per se, but we do feature in that. When it comes to our history, well, we have a long and illustrious history. So the university, well, the hospital itself, actually, St George's Hospital, was established in 1733, initially in Hyde Park Corner in central London. And from 1752, the hospital started teaching medicine. And therein, St George's University of London was born. But it's developed a lot since then. So since the early 1980s, St George's has been located at its current site in Tooting in southwest London. And as I mentioned, has become one of London's 4 major hospitals and is a major trauma centre. Another thing about St George's, there's one more thing to mention too. I don't normally mention this, but interestingly, we've got our Nigerian student today, Halamat Abdulganiu, mentioned this when I spoke to her last week. If you know the TV series, 24 Hours in A&E, which is like a documentary set in a hospital, that is filmed at St George's. So I didn't realize that was broadcast in Nigeria, but I've had a Nigerian student tell me that they were aware of this before joining St George's. So if you watch that documentary or want to find out more, then that's a great place to get a taste of what St George's is like. I think that being part of the hospital adds a really sort of big university feel to St. George's. So I joined St. George's this year from a much bigger London university, which had 20,000 students. St. George's is a lot smaller. So we have around about 5,000 students, 5,500. But it doesn't feel like a small university to me. I think being part of the hospital gives it that energy, that constant energy. It feels like a much bigger place than 5,000 students, and it has excellent facilities that you would expect a university to have, fantastic library, lecture theatre, as well as really specialist facilities. Being a specialist medical school, you have access to first-class facilities for you to be able to practice your clinical skills in a safe environment. So that's things like the radiography simulation suite, the paramedic simulation suite. There's this pathology museum, which has sort of hundreds of specimens collected over the years of different things that I think when learning anatomy, that's a really interesting place to be. And also a dissection room. So personally, I find that I'm a quite queasy, I'm quite squeamish person. I don't like I don't like blood, but I know lots of our students are really drawn by that. There's a medical dissection room, which forms part of the medical degree. But even if you're studying things like biomedical science, or you're studying physiotherapy, you get access to medical dissection as part of your degree, which not every university would offer. I think being a medical school, there's often an extra medical edge to the courses and the experiences you have you may not get at more mainstream universities. Being a specialist university, we have a lot of famous and distinguished alumni. So I think probably most famous, although you may not know the name immediately, people like Henry Gray, who was the author of Gray's Anatomy, which is the seminal medical and anatomy textbook still used in teaching today, and Edward Jenner, who was the pioneer of the very first vaccine in the world. So the first modern vaccine, as we know it, that was the vaccine for smallpox. Other names, you may not know these as household names. These are not world famous people, perhaps to the general public, but people like Hannah Valentine was the first chief officer for scientific workforce diversity at the United States National Institutes of Health. Patrick Steptoe, who was the pioneer of fertility treatment. Sir Patrick Vallance, chief scientific advisor to the UK government. These are all St. George's alumni. Many St. George's alumni are out there in the world making a massive difference, or having made a massive difference in the world of healthcare. And one thing I'll say too, just to get a bit emotional for a minute, I think just in general, even if you don't go on to create a new vaccine or be chief scientific advisor to your prime minister, I think that, it's one thing that always touches me when I look at our students. These are students who are going out into the world, they're qualifying, they'll be changing lives on a daily basis. They're helping people throughout their lives and careers, just general members of the public. And I have to say, at graduation, I always get a bit emotional when I see all these young people knowing they're going to go into the world and really do amazing things and help people on a daily basis. Just lovely to know, lovely to be part of. Our university is located in London, of course, in Tooting, which you may or may not know, but that is a really nice neighbourhood, very lively neighbourhood, and that is located in southwest London, just 25 minutes from the centre of the city, on the tube, by the way, not on foot. But I think it gives you the best of both worlds. It's kind of a more affordable neighbourhood to live in than central London, but equally, it's still quite near to the centre if you want all that central London has to offer. Another thing for me that really sets St. George's apart, comparing to my previous experience, again, my previous university where I worked, which was in the centre of London. I also studied at a big central London university. I think St. George's feels a lot more, it's much more of a community than I think some of other London's big universities, just speaking from my personal experience. 5,000 students means everyone knows everybody. Pretty well, not everybody, but you know what I mean. I think the staff know you on first name terms. Students often comment to me that it's a bit like school in a good way, in the sense that you might know students in the year above you and the year below you on other courses. We have our own accommodation, so you'll be living with the other students. I know, for example, there's lots of crossover with modules. So if you're studying physiotherapy, for example, you'll also be studying alongside occupational therapy students on some modules. So there's lots of kind of collaboration. We have over 120 clubs and societies, which is quite a high number for a small university. And yeah, I think community is one thing that really sort of stands out for me in terms of university life. And if you're coming from another country, I think it's just lovely to know that you're going to be welcomed and supported and sort of safe at a university like St. George's. Like I mentioned, accommodation is located next to campus, about 15 minutes walk from campus, and 15 minutes walk from the London Underground. And I've touched on this already, but this is just some feedback from some of our students. The general things I often hear, I've mentioned, first of all, the friendly nature of St. George's, the helpfulness of the staff and students, that community feel. And another thing too, this is specific to medicine, but I think cuts across all of our courses, is communication skills. I think there's a big focus at St. George's on patient care and teaching really good communication skills. And I've heard actually from other graduates that St. George's is famous for producing graduates with great communication skills. So St. George's doctors apparently are famous in the medical world for being excellent communicators and really empathetic, patient-focused doctors. So what can you study at St. George's? Well, first thing to be clear, we're a medical university, healthcare university, but we don't teach nursing, okay? That's the first thing I should mention. Undergrad range, by the way, these courses here, if you go on our site, you will see a larger range of courses. These courses here are the ones that are full-time and available to international students. So if you see other courses on the site, they're probably not listed here because they're not technically open to international students. So a wide range of undergrad courses and lots of specialist master's programs too. For undergrad, for medicine, of course, is probably our most famous subject. I should mention there's two programs. There's medicine undergrad and graduate route, which you can get onto if you already have a bachelor's. But just to mention, graduate route medicine is not open to international students. So medicine, of course, is a 5-year program in the UK. If you're thinking of studying medicine in the UK, be aware that it's quite competitive. There are limits on numbers for international students. And so at St. George's, for example, we only have 19 places for international students. If you're thinking of applying this year, it is a little bit it is too late, not a little bit. So 15th of October every year is the application date for medicine. But if you're thinking of future years, please get in touch with the SIUK team in Nigeria, and they'll be able to help advise you on your medicine application. I'm happy to be involved too if you want to get in touch with me or St. George's, and you can look at applying for next year. But as for our other bachelor's programs, they would split, I think, into 2 areas. So you've got, first of all, our life sciences degrees. That would be biomedical science and clinical pharmacology. Those are more sort of not totally, they're more not totally lab-based courses, 3-year bachelor degrees. And then we have allied health programs. Allied health are healthcare programs. They're patient-facing healthcare programs. And the 4 that are open to international students are physiotherapy, occupational therapy, diagnostic radiography, and radiotherapy and oncology, which used to be called therapeutic radiography. At some universities, it's still called that. So if you see that, that's the same subject. Therapeutic radiography is radiotherapy and oncology. A bit more of a look into these programs. So biomedical science, hugely popular program, hugely transferable, so many things you can do with it. It's the study of human disease and treatments and many other things too. It's hard to encapsulate it in just one line. I think, again, being a specialist medical university, you have a range of lots of different pathways. So you can specialize in lots of different areas such as anatomy, genomics, global health, that's more sort of a policy pathway, as well as clinical bioscience, which is probably the route you would take if you want to go on to graduate route medicine. So for many students that don't make medicine at 18, 19, sometimes another route would be to do a bachelor's degree in something like biomedical science and then apply for a graduate route medicine program. So that's an option for you. But the great thing about biomedical science is it opens up a lot of doors for you. There's so many different things you can do with it. On the right there, you'll see lots of different company and organization names. So one thing you can do at St. George's is do a placement year. So that's after your second year, take a year out and work in industry. And I think the fact that we're such a specialist uni, the whole uni revolves around the world of healthcare and medicine and science. So we have so many partnerships, so many contacts, so many fantastic organizations you can do a placement with. And speaking about what you can do with a biomed degree, so many different things. So many students, of course, will go on to work in research, in biomedical research and labs, but not only that. Many go on to work in forensic science, the more commercial side. So, biotech startups, biomedical product marketing, for example. Some go to work in policy, grant funding. intellectual property, the civil service, for example. You may go and work for the Ministry of Health, for example, in your home country or in the UK, perhaps. And many go on to further study. So biomed can be sort of a step on the way to studying medicine, dentistry, or perhaps doing an MSc pre-reg in physiotherapy or occupational therapy, further study in biomedical science, genomics. We even have some students that one alumni recently, for example, studied law. She did like a law conversion course and now works in kind of medical law. And probably that's a really fantastic career option. Some go on to train and work in finance. I think the analytical skills, the data skills, all those kind of skills you pick up in studying a science degree are really transferable to other sectors. So, well, not literally, but the world is your oyster. Well, it's not literally your oyster. The world is your oyster with a biomedical science bachelor's. Clinical pharmacology too is worth looking at. It's a new program for us. Well, newish. This is its 4th year, so we had our first graduating cohort this year. Feedback has been really positive, and we're really proud to be ranked as the top university for pharmacology in the UK, according to the Guardian University Guide. So that's excellent feedback on that program for us. Pharmacology is the study of all aspects of drugs as they relate to humans. So you look at disease, you look at drugs, how they work, how they interact with the human body. Again, it's a 3-year program, but you can do work placements as part of this program too. And it's not just being in a lab. People ask, what does clinical pharmacology mean? What's the difference between pharmacology and clinical pharmacology? Clinical pharmacology is just a little bit more applied. So traditional pharmacology degrees can be quite lab-based. You may spend 3 years in the lab studying the science. This one tries to be more applied. It doesn't try to be, it is more applied. And you get to do lots of different projects, such as, looking at, for example, you learn about data analysis, running clinical trials, drug development, presenting new drug development ideas to research institutes or pharmaceutical companies. And the program was indeed designed in collaboration with employers to produce graduates that the pharmaceutical sector is looking for. But I want to focus a bit more on physiotherapy and occupational therapy and these other programs, because I know that in Nigeria, there's a big interest in allied health programs. So just to touch on the 4 areas, of course, physiotherapy, probably a lot of you know all about. Physiotherapy, a lot of people, it's a very popular course. A lot of students get into it because they love sports and they want to be in the sporting world. So yes, physiotherapists do work a lot. Will go on. Many graduates do go on to work in the sporting world, in more the kind of the commercial sporting world. But just to be clear, physiotherapy is a clinical course. So you will be spending a lot of time in hospitals as well as part of your training. So being part of a medical university, we do have that kind of nice clinical edge to our physiotherapy program. But graduates do go on to work in many different settings, such as NHS and private health clinics, health centres, sports clinics, sports clubs, private practice all around the world. Some work, I think, freelance as well. Occupational therapy, Jane here on the call is from our occupational therapy course. I'm going to let her talk about occupational therapy in a minute, but we have our BSc and MSc pre-reg of that course. And I think occupational therapy is a really fascinating area, probably the least clinical of all of our kind of healthcare courses in terms of it's the least hospital-based. And I think one of the most misunderstood in terms of the full range of what occupational therapists do. There's a huge breadth of roles and settings that they find themselves in. I find it really fascinating. I'll let Jane talk about that. Don't want too many spoilers here. And then we also have our 2 radiography courses. So diagnostic radiography, probably it is what it sounds like it is. You're learning to use a range of modalities such as X-ray, ultrasound, CT scan, MRI to diagnose different conditions with patients and find out what is going on inside, whether that's injuries, whether that's underlying illnesses or conditions, for example. Probably quite a clinical career route with that one. You'd likely go on to work in a hospital and in NHS healthcare, in private healthcare, or some students will go on to further research, further study or teaching. And then radiotherapy and oncology is probably the most specialized one. So our graduates, with that program, what you are learning specifically is treating cancer patients with radiation treatment. So very specific course, but fantastic career pathways for those students. There is actually a global and national shortage of specialists in this area. And likely students would go on to work in NHS healthcare, private healthcare, research or teaching. Just to summarize then, allied health programs at St. George's, whether it's physiotherapy, occupational therapy, or either of our radiography programs, I think it just makes sense, doesn't it? You're studying a healthcare subject at a hospital setting. You're getting access to unparalleled expertise. I should have mentioned too, many of our teachers are also, most of them are healthcare practitioners. Either they've worked in healthcare practice, some are still working in healthcare practice. They put me to shame. They do 2 jobs, they teach and still do their day job as well, which I find incredible. So they're bringing real world experience into the classroom. There's not just academics that spend their lives in a library researching. These are people that know the job and know how it's done and know all about their subjects. So you're taught by real healthcare practitioners. You have access to the specialist healthcare facilities, such as the dissection room, the radiography simulation suites. Around 50% of these programs will be spent on placement as well. So you do come away with a lot of experience. I meet a lot of young people at fairs, for example, that say, I don't know what I want to do. I just want a degree where I'm not stuck in a classroom all the time. Or they'll say, I want a degree where I want a job where I'm not stuck in an office all the time. And I do think it's really worth looking at these programs. You literally hands-on learning on placement for 50% of your program. Should mention it's not just one big placement. Depending on the program, they're all different in terms of how many placements you do. But you may be doing, I think on radiography, for example, you do, I may be wrong, but you do 2 big placements, whereas I know in physiotherapy, you do, I think, 6 shorter placements. You need to double check the site. The course pages will tell you exactly what the placements look like. And just to be clear, those placements are in London or the surrounding areas. Also, to be clear, not all placements are at St. George's. That's one misconception. Students are like, great, I can just stay in St. George's for 3 years. You may be lucky to get a placement at St. George's, but you will likely get a selection of different placements in different settings. Excellent career prospects for students, either in the UK or internationally. I think if you look at the stats, usually it's something like 98 to 100% of students in employment or further study a year after graduation. And most of these programs are all of these programs are internationally transferable to different countries, though you would need to check that yourself. The onus is on students to make sure that if they want to take this back to their home country, that you check it will be accepted first. But I do know that UK healthcare qualifications are highly internationally transferable. I'm just going to summarize quickly because I do want to hand over to Jane in a minute. I don't want to monopolize the time here. Another route, which I think is really worth looking at, is the pre-reg courses. So if you're in Nigeria and you have a bachelor's in nursing or biomedical science or physiology or something else probably in the science arena, you can also look at doing a 2-year pre-reg conversion course. So for example, you could do the occupational therapy pre-reg or the physiotherapy pre-reg, and that qualifies you to be a UK level occupational therapist or physiotherapist. I believe, Jane, not if I'm correct, it's equivalent to a bachelor's degree, right? So you are fully, yes, there's a nod, good. You're fully qualified to practice in the UK on the NHS and internationally also. And that is open, like I mentioned, to applicants if you have a science or healthcare bachelor's equivalent to a UK 2-1 honours. So really worth looking at. I know that in Nigeria, there's a huge interest in nursing, but if you're interested in nursing, some of these programs might also be worth looking at too, because I think lots of students, they think about nursing because it's what they know, but things like occupational therapy, radiography, they also offer you fantastic career pathways in the UK and internationally, and are perhaps really worth looking at as alternatives to nursing. Not going to dwell too much on this. We do have a range of other specialist 1-year master's programs. I think some key ones to mention would be things like genomic medicine. Genomics is a huge area of development in the UK at the moment, and that is open to biomedical scientists, doctors, nurses, pharmacists, healthcare practitioners. It's a great area to specialize in the UK at the moment because there's lots of development in this area in healthcare. And global health, we get lots of demand from Nigeria for global health courses, which can lead on to careers in global health development, policy, education, and humanitarian relief. In terms of tuition fees for international students, for our bachelor's programs, you're looking at around about £18,000 to £20,000 a year. And the same with our master's programs, the MSc pre-reg of £18,000 a year as well. Often we get questions about scholarships. We don't really have full scholarships for international students. However, we do have a range of smaller scholarships. So for each of our master's programs, there are 4 scholarships per course of £3,000 each. These are competitive and merit-based and are awarded to the 4 highest scoring students or the 4 highest scoring applicants for each master's program. There is also 1 full scholarship for MSc Global Health for international students. I should mention that these 2 ladies you see on the screen here on the right, you've got Peace. She was from Nigeria. I believe she was a scholarship recipient last year. And then the lady next to her is Sandra from Uganda, who also was awarded, I think, a Chevening or a Commonwealth scholarship. So, you know, many students do manage to get scholarships in Compass St George's from our international community. Entry qualifications, if you have just the WAEC, Nigerian high school qualifications, you would need to do a foundation program before entering St George's. We do work with a range of foundation providers. Again, I would speak to the team at SIUK to get more information on that. Entry to undergrad, we will accept A-levels, IB, US high school diploma. Typically, apart from medicine, most of our programs, you would need something like around about A-levels, BBB. Some of our programs will require science. Not all of them do. I mean, I think probably it's helpful to have a science, but for physiotherapy, for example, and occupational therapy, we don't insist that you have chemistry and biology, for example. And then for postgraduate programs, typically it would be a 2-1 or a 2-2, depending on the subject you've studied. So I think for the pre-reg, we ask for 2-1, but for the other programs, we may accept a 2-2 if you've got a very relevant experience or relevant subject area. And when it comes to English, we accept a wide range of tests. I should mention, if you have Nigerian WAEC, English C5, you don't need to do IELTS or TOEFL or something else, but that WAEC should have been taken within the last 5 years. That's the only stipulation. And I'm just going to leave it there and hand over to Jane. But just to summarize, St George's, if you want to study a healthcare subject, I think it makes a lot of sense. We're the specialist healthcare university of the UK. You're getting unparalleled expertise from practitioner teaching staff, top university for UK career prospects, located at a hospital, and a distinguished university doing excellent research and part of the University of London. So I'm going to hand over to Jane. Just to say thanks everyone for listening. Happy to take questions at the end.
Okay, thank you, Malcolm. I'm going to try and share my screen now. So just bear with me because I'm not always the best at doing these things. Okay. So as Malcolm says, I'm Jane Cronin-Davis. I'm the course leader for both programs at the moment. So both the undergraduate program and the master's program, which starts in 2023. I'm also Dean for Welfare and Support at the university, so I have a pastoral overview of what's happening for students. I'm also one of the associate professors, so I have a lot of hats, as Malcolm alluded to. But I've been asked to do a whistle-stop tour through the occupational therapy provision. So I might skip a couple of my slides because I'm glad I sat in on Malcolm's presentation because there is a couple of slides that are very similar. So bear with me. I'm just making sure, can you all see my slides? Malcolm, can you see my slides? Yeah, okay. Brilliant.
Yes, we can.
All right, thank you very much. Thank you. So I'm going to just take you through the sort of program content, why St George's, and possible next steps. So I'm not going to go on this slide because Malcolm's already talked about why St George's. But why St George's for occupational therapy? So far, we've got very well established undergraduate results. More than 50% of our students come out with what we call in England a good degree. So they either get a first or a 2-1, and that includes our international students. More than 90% of them post a job shortly after graduation, but a lot of students are getting jobs before they even graduate in occupational therapy because of the national shortage of occupational therapists. We have a thing called in the UK called the National Student Survey, which third year final students are asked to complete, and we've recently had a score of more than 90% for that. We have a very diverse group of students from very different backgrounds, very different circumstances, very different faiths, and over 50% of our student group are what the students report to be Black African. So we have a very, very wide group of students. Our team is, I won't dwell too much on this because, sorry, I don't know if you can see a red line. Can you see a red line on your presentation? It's coming up as a red line on mine, but maybe not. We've got skilled academics. We've all, oh, is it coming? Is it red lines coming up? Maybe not for you. Maybe not. Okay, so we've got a range in our team. We've got a range of clinical experience. We've got people who've come from neurology, from trauma and orthopedics, from mental health, community, elderly, people who've worked with children and adults with autism and learning disabilities. We all have to have a teaching qualification to work at the university and to be able to teach students. And all of us have got national or international networks that we still, I think Malcolm alluded to, was all working in clinical practice very often, but we also have networks to enable us to bring things, you know, that we think are relevant to the curriculum. And then some of us have been involved in NICE guidance, which is the National Institute for Clinical Excellence, and we have people that have worked with the Royal College of Occupational Therapists, and I myself have worked with the World Federation of Occupational Therapists. So I'm not going to go through all of us, but that's the group of us that are here with all our different our different roles. So we've got two programs, as Malcolm has told you. So we've got the 3-year undergraduate program, which is the traditional type of occupational therapy program that you would get, you know, either in the UK or perhaps around the world. And then we've got a 2-year accelerated program, so you can fast track through that program, and I'll tell you a little bit more about that later. Our graduate prospects are very good, and our students who have graduated are now taking some of our students on placement, and some are now in senior positions, and those are people that graduated in 2020-21, so they're already working as seniors. The important thing for us is that they're both approved by the Health and Care Professionals Council and the Royal College of Occupational Therapists. Otherwise, you can't get professional registration. But we're also recognised by the World Federation of Occupational Therapists. And international students are very welcome to the programme. We're going to have 2 places for international students on the master's programme, and we've got I think up to 5 student places on the undergrad, but typically people will come for the international students will typically come for the master's program, and the one that we've got has been written for with the USA criteria in mind. So a graduate from that program would meet the criteria for a USA occupational therapist, but they would still have to take the USA exam. So just quickly, the 3-year program is 30 weeks of teaching per year, and all students will have to do 1,000 hours of clinical practice, which is spread over 4 placements. And that's a World Federation of Occupational Therapy requirement. So all programs in the UK will expect you to do 1,000 hours. And we have shared learning opportunities with all those professional programs that Malcolm's already talked about. And then on this program, we have a mixture of teaching and learning styles, a range of assessments, and hopefully this is attractive to a lot of people. We only have 1 exam, which is a very short exam in first year. For the MSc, it's slightly different. It's 45 weeks per year, and we have a criteria of 80% attendance for all modules on that program. And we have, again, the 1,000 hours, which is works out to be about 28 weeks of placement full time. So, and those placements for both programs are usually Monday to Friday, 8 to 4, 9 to 5. But sometimes there are placements where people are expected to work shifts or over the weekend. And this second program, the master's program, is our problem-based learning program, which mirrors team working, shared learning, and the skills mix you need for professional practice. And you'll only ever be in one module at a time in this program, whereas in the undergraduate program, you might be doing up to 3 or 4 modules at a time, at the same time. I think it's really important for us to think, and I'm glad Malcolm didn't speak about this because it doesn't mean that I can, but the support for studies during, whilst you're here at George's for us, so that you can maximise your potential is vast. And you can see some of the in the diagram there, you can see some of the support services that we do have. Everybody would have to have an occupational health clearance before they started the programme. And some of our students, if they've got health conditions or we need support and advice, they might have ongoing occupational health reviews or assessments. And we do make reasonable adjustments to students who might have a disability. And that can be any kind of disability, from mental health to a learning disability to physical health conditions. And I would say 30% of our student population would be a student that needs a reasonable adjustment for their particular needs. And so what we're asking people is that if they feel that they might have a particular need before they come to us, is to talk to us before they come, and so that we can kind of set things in motion before people start the programme, so that we're trying to avoid things impacting too much on people's studies. And what I would also emphasise at this point is if you have a disability, whatever that might be, that doesn't prevent admission to the programme. But what we would have to do is think about how people can manage the programme. But what we want to do is support and negotiate with somebody who might want to join us. So those are the things that underpin our programme. So obviously there's occupational therapy theory and practice, and these go for both programmes. Our programmes are underpinned by the discipline of occupational science. I could spend a whole hour talking to you on that, but I'd ask you to go away and think about that. But really what we're looking for is people's knowledge on the health, well-being, occupation and environment, and how those kind of interdepend on one another. There's a strong emphasis in our programme on research and evidence-based practice. And in either programme, you would have to take an independent research project, where you have a dedicated research supervisor, which is from within the team that I've put on one of the earlier slides. And then our professional practice options are around London and the South West London area, but we're also we're just starting this year to offer international placement. So we have one student going to South Africa, and we have we have students who are interested in going to Bangladesh, for instance. So I think if people wanted to go back to their home country and do a placement, there might be some possibilities about for people going back to Nigeria, for example. But we would have to talk to people about that and where they would want to go on placement. We can't just send students anywhere they might wish to just go. We have to quality check the placement that they might want to go to. So next steps, Malcolm's already talked about the MMIs. Oh, did you, Malcolm, or was it a conversation we had beforehand? No.
I didn't mention it on this, but I don't know if we need to go into much detail right now on that.
Okay,
just,
that's fine.
Yeah,
okay,
there will be an interview though.
Yeah, there will be an interview. And our selection is based on people's UCAS application. So having a really good personal statement that indicates what occupational therapy is as a career, having your appropriate qualifications. And we do put volunteer and work experience, but that can be any kind of volunteer. We're not expecting you to have volunteer and work experience as an occupational therapist. You might go and work in a care home. You might be working in a charity, for example, but anything that kind of indicates that you've had some experience of the world and people that might need care and things. So, yeah.
One question, Jane, actually on that. This is a question that's come up. I'm preempting the slide. One question that's come up actually in the last couple of weeks from some international students. Like what if a student at this stage is thinking of applying for September, but hasn't managed to get any volunteering experience? I know that with the pandemic, sometimes you're a bit more relaxed about that. What else could a student do if they don't have work or volunteering experience?
Yeah, no, we have students who, for example, are able to demonstrate that, you know, they may have worked in retail, for example. So, and within that, they're able to say that, you know, this helped me with my communication skills, that sort of thing. So it's trying to see what people have, you know, what the people have done that might help them with some of the skills they might need to be an occupational therapist or any of the other healthcare professions that you've
Or even
outlined
caring for
already.
family, right? So like if you care for elderly relatives or have younger siblings or nieces or nephews that you have to babysit or look after, you can draw on that experience, right?
Yeah, yeah. And very often people will tell us that a family member has had has had to have occupational therapy interventions, and that's what's drawn them to the career. So it's kind of, we're not very specific about you must have done this, that, and the other. Yeah. Yeah. So that's me. So it's now time, is it time for questions now?
Yes, we can take questions. Also, in theory, we should hand over to Halimat Abdulghani, our student.
Oh, yes.
I don't know if
Halimat.
I don't know if she's here.
I'm going to stop sharing my screen now.
If not, we can go to questions. Oh, I can. Yes, I could hear Halimat's voice.
She's there.
I could hear your.
Okay.
Sorry, Halimat. Sorry.
No,
So
it's
Halimat,
fine.
yes.
It's fine.
So Halimat is a student from Nigeria who's studying with us this year. Joined this year on the MSc physiotherapy pre-reg course. I believe you've got a bachelor's in physiology from Nigeria. Yes. So yeah, it would just be nice to hear a bit about your experience as a Nigerian student at St. George's, and yeah, how it's gone so far.
So initially I was a bit scared, you know, like I think, you know, making a big difference, like making a big change from Nigeria to the UK, it's daunting at first, but I think when I initially when I resumed, they really kind of, you know, set side to kind of, you know, bring me into the system gradually. So it wasn't like, oh, you've resumed, you just take this and just go with it. So I really liked that they gradually, you know, brought me into the program, and we had like a foundation program where they just basically just built your foundation on what the course was about. And then the international admissions team also created like, you know, different meetups with international students where we're able to like socialize and, you know, take a break off studying for a few months, like a few first to second month when I initially started. So my experience has been really nice. Yeah, I think it's better than I actually expected, because I was really scared when I was coming here. I was so nervous. I was having issues. Like I was thinking, would I be able to would I be able to pass? Like would it make sense to me? Because it was yeah, so but you know, I like the fact that they eased me into it gradually. It wasn't just like blow in my face. Yeah. So that's really nice. And then St. George's University is it's just medical courses. So that really helps with kind of like building that environment, that study environment where everywhere I go, I can have a question about something, and then it doesn't have to be a physiotherapist or something that can help me out. So I can have an issue with anatomy and I'm meeting a medical doctor, or I'm meeting a medical student or a medical doctor or an occupational therapist, and we're discussing, you know, these similar issues, and I'm having different ideas that actually, you know, add into my own, you know, my own profession, and that I really like that aspect as well. Yeah.
That sounds great. What kind of sort of career prospects do you see for yourself at the end of this program? So, I mean, I know it's only semester one. We're not even at Christmas yet, but you know, where do you see this leading to? Like, what kind of options do you see for yourself?
Oh, for myself, I think I've just taken my neuro exam, so I have musculoskeletal and cardiorespiratory, and for me, I think personally for me, I'm always like, I try to wait till I have my placements to kind of gauge where or like what I want to do. So currently I'm looking towards like maybe musculoskeletal and or neuro or something like that. But in regards to like where I want to work, I think you could work anywhere basically. I've heard people I've had conversations with students who went to US, that went further into US, and we're also looking at working in Canada or like different places as well. Germany, you could work in Germany. You could also work in the UK as well. So that's an option for you as well. So just know that you without limitations. Yeah.
It is true. I do believe there is quite a global shortage, and in general with allied health practitioners, I do know it's a good point. I know that it was your colleague Jane Rachel, I think, was mentioning that there's recruitment consultants in Canada for occupational therapy that contact our students to kind of try and attract them to work in Canada too, because there's also many opportunities. Yeah. Thank you, Halamat. Do you have any more questions for Halamat, actually, Jane, about her St. George's experience?
I just wondered, Halamat, if it was worth saying something about the size of the classes that you're in, and how many students might be in your classes. Because I know for occupational therapy, we're only going to have an intake for the master's program of 17, and for our undergraduate program, we only have a class of 30. But for the masters for the physio programs, it's a much bigger cohort of students, isn't it?
Yeah, that's true. I think in my set, we're almost like, we're not up to 40. Yeah, we're not up to 40. But initially when I applied, they said that the places were like, there were 40 places, but we're not up to 40. And what they did is basically they divided us into M1 and M2. So M1, so we have lectures together as one, but then we have different practicals. So different practical groups, different tutorial groups. Yeah. So we're like 15 to like 15 students in one group and 15 in the other, or something like that. And then we were able to communicate with our tutors, with our lecturers, with our practical supervisors, and kind of, have this secluded, personal interaction that really helps you to improve in your knowledge. And I think that has really helped in me kind of like voicing out questions or giving answers, because I know that it's kind of like a small group. Yeah, and that creates opportunity for me to actually give my responses or ask my questions, because then there's no 30 other students who have questions to ask. Yeah. So.
Yeah. I think that's a really nice point that you've made there, because I teach on the physio program as well as I teach on occupational therapy. And I know that we do a lot in both programs in very small group teaching, just for the sort of reasons that you've outlined nicely there. So we don't do lots of massive lectures all day, every day. It's much, much less than that. There's 1 or 2 lectures, but a lot more kind of group work, skills-based teaching, so that you can get those practical, technical skills that you need to be as a professional. Yeah.
Thank you very much. I'm actually just going to open up now. Thank you very much, Halamat. I really appreciate you joining us today, and it's been really nice meeting you in the last few weeks, and hopefully we'll do more work together over the next year. Please stay on the call, because we have about a few minutes left, and I just want to sort of open up to everyone else. I don't know if Gloria or Vinayak, you want to bring us back or facilitate any questions from the attendees, or I was happy to stay on a bit longer and answer some questions.
Hi, Malcolm. That was a interactive session. Thank you so much. Okay, so it's question and answer time. Please, if you have any question, kindly drop it in the chat box. I'll just see it and Malcolm will answer. Please drop your questions in the chat box. Okay, so quick one, Malcolm. Can you please talk about the school fees, the payment plan, if there's any?
So yeah, so for most of our programs, the main ones we mentioned today, so the bachelor's programs and the master's in physiotherapy and occupational therapy, the pre-reg, they are around about £18,250 a year. The payment plan for that, so scholarships, there are limited scholarships for master's programs, and we're only looking at around about £3,000 per year, and there's only 4 of those per course. So I don't want to go into scholarships too much, though I would say if you want to discuss that, please speak to the SI UK team. But payment plan, I think, is quite straightforward university payment plan. So for international students, you would need to pay £3,000 deposit to secure your place and get the CAS for the visa. And then I think it's something like you pay 50% total, including the deposit, rounded by October, 25% by January, and then 25% by the end of the year. So it is an annual payment plan with kind of different installment dates. But that's quite standard for most universities, I believe.
Hi, can you hear me?
Yes, I
Yes.
can hear you loud and clear. Yes.
Hello.
Hi. Yeah.
Oh, thank you so much, Malcolm.
Thank you very much. Just want to say one more thing about application dates. If anyone wants to apply for one of these allied health programs, for occupational therapy, physiotherapy, or the radiography programs, for international students, Jane, you may not know this, so don't look shocked, but for international students, we have extended the application deadline to the end of to the 1st of April. So for UK students, you have to apply by January, but for international students, because the interviews happen remotely, where we have a longer window for international students, so you can apply by the 1st of April. For other courses, that's our 1-year master's programs or biomedical science or clinical pharmacology, you can actually apply up until the 30th of June. So you have plenty of time, but I do advise students to apply sooner than that. I know that the whole immigration, like the whole getting the visa from Nigeria can take quite a long time. There's huge demand for the UK at the moment. So that's just a bit about application dates.
Yeah, can
Sure.
I just say one thing? So when and it does differ for physio, so I can't speak for the physio dates, but when we interview or we get our interviews and we make a decision, we make a decision on the day that we have the interviews for our applicants, we will let people know. They will get an official information email from the university, but we will phone our applicants and let them know whether they've been successful or not. So we tend to run our interviews just slightly, the post-interview process slightly different to other programs, but we will let our applicants know very quickly whether they've got a place or not. And I think
Same day service.
Yeah, same day service. And I think it's particularly important for people who are coming from other countries who are applying, because they have to get things so much more things in order than our UK students. So we will let people know as soon as possible. The other thing I did want to say is that you have got my details, and I can put my details in the chat. But if there are questions, and I know that when you're on a call such as this, it's very difficult to answer a question, to ask a question, or to put something in the chat. But I'm more than happy for you to email me individually, and I will respond to questions if it's particularly about the programme and the application process that we have. So I'm going to put my name in here, my email address in here, and if people want to get in touch with me individually, I'm more than happy for that to be the case.
Thank you, Jane.
Okay, so somebody just asked, what's your application turnaround time?
That's a good question. Yeah.
That does differ. So because we're a medical school, what tends to happen, and because the medical school process in the UK is very tight, all the medical school interviews are, or for medicine programs, are done first, and then the other programs are done kind of afterwards, so after January. So if you haven't heard, if you put an application in and you're not hearing straight away, either email one of us and ask what's happening, but don't be too put off by maybe having a little bit of a wait. And then what happens is that we look at the application form that comes to us, we screen it, we have criteria by which we, sorry, that's my dog barking in the background and I can't mute her. So we have criteria that we look at through people's personal statements. Obviously, they have to meet the educational criteria. And then if they meet all those things, then we would invite somebody for interview. And that we're tending to do, international applicants can come to the university, or they would have what we call a remote interview. Sorry, you can see the dog running in the background now. They would have a remote interview where they record their answers, and then we look at those interviews and score them. So there's a kind of two-part process. So there's the initial scoring of the person's initial application and then their interview score, and then based on those two things, they would be offered a place.
Okay. All right. Thank you so much, Jane. Thank you for joining us today. Can you hear me?
Yes, I can hear you. Yep.
Right, so we don't have any more questions. You've literally covered everything that needs to be, you've covered everything and all aspects. It was a great time. What an interactive section. Thank you for joining us today.
And thank you very much. Thanks everybody for joining. I personally have had a good time too. I could keep talking for the next half an hour, but I'm sure you'll have to go.
All right. So have a great day, Malcolm.
Thank you. Take care, everybody. Look forward to hearing from you all. All the best.